No, not on your legs, just by your side. Just literally by your side. There you go. Okay, so we need to know the zones that we're looking for. So we need to go from L to S. We're not doing upper dermatose. We're doing a lower quarter screening, right? So for this, make sure their eyes are closed. Always have their eyes closed, right? And for L1, you're just following the zone of L1, right? So for L1, all we're going to do is keep your eyes closed. Do you feel this? Do you feel this? Does it feel the same on both sides?
Yeah.
Great, and you can always change up the sensation, right? So L2 is going to be going diagonal through here. Do you feel this? Do you feel this? Same or different?
It's different.
Okay, it's different. So you can ask that. I want to see you do that, not always do the same texture, right? L3 is going to come through here. Do you feel this? Do you feel this? L4 is going to go across the front of the kneecap and down. Do you feel this? Do you feel this? And you're looking for same sensation. It's checking for neurological deficit. L5 is going to be lateral aspect of the shin. So do you feel this? Do you feel this? S1 is typically the side or lateral aspect of the foot. So we're going to go out here. Obviously she's wearing shoes, but do you feel this? Do you feel this? And then S2 is going to be posterior aspect of the leg, right? So S2 is actually going to be going like back through the calf and into the hamstring. Do you feel this? Do you feel this? So the whole time you're doing it, you're keeping the eyes closed and you're knowing exactly where that zone is, right? Then what you're going to do is you're going to do the myotome. The myotome is the muscle. Every time you do a manual muscle test for a neurological screening, you do grade 5. So you do, all of your myotomes are break tested, right? So you don't do grade 3 or 4, anything, just think grade 5 every time you get the test, right? So you just need to know the motion. So L2 is hip flexion. So go ahead, you can open your eyes, bring your knee towards my hand. Hold it there, stop, don't let me move you down. Good. Do the same thing with the right one. Hold it there, don't let me move you down. Good. And that would be L2. L1 has no myotome. So if I ask you L1, it's a trick. There is no myotome for L1. L3 is knee extension, so go ahead and extend the leg. Don't let me push you down. Good. Go ahead and extend the leg. Don't let me push you down. Good. And you're always going to check bilateral for all of these tests. So just assume that you do both tests. L4 is dorsiflexion. So let's just bring the leg up, bring the foot towards me. Don't let me push it down. Good. Don't let me push it down. Good. L5 is going to be big toe extension. So we're actually going to bring the shoes off real quick. Should have done that.
I think there's a hole in my sock.
Oh my gosh. And this one as well, because we have to do both sides.
There's a hole in this side.
There's a hole in this sock.
Nope.
Okay, no problem. Okay, so relax down, actually, relax down. So extend all your toes up. But obviously I'm just going to isolate the big toe, don't let me push it down. Isolate the big toe, don't let me push it down. Hold it, don't let me push it down. Good.
Are you sweaty?
Okay, so S1, it has multiple movements, but you're only going to do plantar flexion. So S1, point down, point your foot down. Don't let me push you up. Good. Don't let me push you up. Good. And S2, we're going to do knee flexion. So for S2, you're just going to do knee flexion. Don't do all of them, just do knee flexion. I know it says a lot in the book. You're just going to do plantar flexion for S1 and just knee flexion for S2. So go ahead and extend the leg. Stabilize the knee. Curl down towards your butt. Curl. Good. And do the same on this side. Curl down. Good. The other thing that you do need to do, and I don't have enough reflex hammers for you to do it, so you can either use your hands or you can use the side of the scissors, is I want you to know that we have a knee reflex. We have Achilles one too, but really so you need to know the Achilles reflex and the knee deep tendon reflex. So for a deep, you'll see docs do this all the time, they use a reflex hammer. You can use your hand, you just have to make sure you relax them, and then all you're trying to do is just see if you can get a little kick out on their leg like that, right? Relax, relax, relax the leg. There you go. Like that. And you don't get as great a one at the Achilles, but you do need to know how to do it. So for the Achilles, you're going to slightly dorsiflex. And a little bit, right? Hold on, relax, relax. Little bit. So you have a deep tendon reflex here at the knee and a deep tendon reflex. So if you get knee deep tendon reflex, I want you to go ahead and judge that reflex. We typically use a reflex hammer, but I'm okay with you using your hand as like a ninja chop. But for that, no dermatomes, no myotomes, just for lower body screening. Know the definition of a dermatome and myotome, which we went through on the board. Okay.